Doctor, how do you know? Like, is it only through like lab diagnosis that you know if you have active TB?
So the TB has multiple forms. It can affect any part of your body. It is mimic. When it comes to between latent and active TB, latent TB is a diagnosis where you see a skin test positive, but you do not see um, any other lesions in any other body parts. If you see somebody with active TB, that means they either have organisms which are actively multiplying. That is the basic difference between active and latent TB. If I have pulmonary TB, what that means is I have an infection which is actively getting worse. The organisms are actively multiplying. So when you have a patient with pulmonary TB and who has active lung disease, it is all about testing them to determine whether they're infectious or not. And you can be infectious or non-infectious with an active TB, depending upon what stage of treatment you are in. Let's say I diagnose a patient with pulmonary TB and their sputum is growing acid-fast bacilli, and they test positive for MTB. They are infectious because their sputum is producing organisms. Their sputum has organisms. And TB is one of those weird organisms where you don't need a big inoculum to get an infection because it has defense mechanisms against your body's immunity. When it comes to patient's infectious nature, the sputum testing or sputum PCRs are the way we say the patient is infectious or not infectious. Can you have active TB without being infectious? Absolutely. If I take the same patient and I put him on treatment with multi-drug anti-TB therapy, their sputums may convert within a week or 2 weeks, but that does not mean they don't have active TB. They have active replication going on inside their lung because we know they have a pneumonia and that pneumonia did test positive for AFP. So to answer your question, latent TB just means that you had an infection, but the organism is cornered into an area. Like most commonly, it's called a gone complex. We see a scar in the right upper zone or the left upper zone or in the right middle lobe. It's called a gone complex, which means you had an infection, your body put a small wall around it and did not let that infection spread beyond that particular region. These patients are usually not infectious, but they still need to be treated, which means, okay, their skin test was positive, they have a lesion, they still need 6 months of dual drug therapy, or depending upon what regimen you choose, it may be different. But active TB means somebody who's actually not confined to one location, but this infection is spreading and the disease is actively replicating inside them. Okay?
Mhm. Thank you so much, Doctor. I think that's like a wonderful insight. And to whoever was asking about tuberculosis, if you want to if you want to consult with Dr. Kakkera or any of our other doctors, please feel free to get on to the My American Doctor website and book the consultation. Thank you.